Hi, I'm Dr. David Sparks, and I'm here to talk to you about insomnia and the importance of sound sleep, something that a lot of you suffer from. Okay, a couple of questions. Do you have trouble falling asleep? Do you have problems staying asleep? Do you toss and turn throughout the night? Does your mind begin to race the minute your head hits the pillow? Do you run through endless lists of things to do in your mind? Do thoughts about the past or future play like never-ending movies in your brain? Continuing the questions, do you ever feel depressed, anxious, or just plain burned out? Do you wake up in the middle of the night with anxious thoughts that prevent you from falling back to sleep? Well, if any of those things occur, and I know they probably do to many of you, let's talk about insomnia. You get into bed, close your eyes, and hope that Mr. Sandman comes along and helps you drift off. But no, you start going over things in your mind, and you can't turn your mind off. This is called mind chatter. You toss, you turn. You start to get more and more anxious and can't seem to get your brain to shut up. The harder you try, the worse it gets. If this describes you, believe me, you're not alone. Millions and millions of people suffer from insomnia. Okay, what can we do about it? Cognitive behavioral therapy for insomnia, CBTI, you can look this up on the internet, is often structured as a treatment program that can help people who have difficulty falling asleep, staying asleep, or find that sleep is unrefreshing. Some strategies for cognitive behavioral therapy involve image replacement, where in your mind you picture yourself lying in a cozy cabin with the fire going, or lying under a tree in a meadow with warm sun all around you, or lying on a beach with the sound of gentle waves. Another technique is to use something called mindfulness. And you hear a lot about mindfulness these days. Mindfulness is where you, just like a cat or a dog, don't allow yourself to think forward or backwards. You just stay in the moment. And we've all heard the term counting sheep. That's a reference to doing something repetitive in such a way as to literally bore yourself to sleep. Google insomnia and you'll find all kinds of information concerning cognitive behavioral therapy programs, if that's a technique that you'd like to try. And then, of course, there are always prescription drugs or sedatives that doctors love to give you. At any rate, insomnia plagues millions and millions of people and produces ill effects on your health and how you feel. Discover how important sleep is to your health, mood, memory, hormone production, libido, even weight. So, my final thought, Google cognitive behavioral therapy and find out what works and what doesn't work when it comes to overcoming insomnia.